Bismillahirrahmanirrahim. Today we talk about the disorders of the oral cavity. You know that oral cavity is the first part of the gastrointestinal tract, and food that we take, it is masticated, chewed, and mixed with salivary secretions, which converts the food into a semi-solid mass known as the bolus, which is further moved through the esophagus into the stomach where it is further processed. Now, the lesions of the oral cavity, for our convenience, we divide it into four types. Number one are the oral inflammatory lesions, where inflammation is involved. The second are the oral proliferative lesions, where cellular divisions and proliferation is involved. The third is the oral neoplastic lesions, which consist of benign and malignant tumors, and the salivary glands, which are located inside the oral cavity, are also the target of many diseases. So, today we will discuss the first part of the disorders of the oral cavity, and that the topic is the oral inflammatory lesions. Now, in the oral inflammatory lesions, we discuss three diseases. Aphthous ulcers, which are simply known as the canker sores, the herpes simplex virus infection, and the fungal infection of the oral cavity known as the oral candidiasis or monilial thrush. But something important to remember about these three conditions which make the oral inflammatory lesions, that the Aphthous ulcers, these are the result of an autoimmune reaction, right? Now the herpes simplex is a virus, and this condition is caused by infection by the virus herpes simplex. The third disorder known as the oral candidiasis, you know that the candida albicans, it is a fungus and it is a fungal disease. So the three conditions, first the Aphthous ulcers are the result of autoimmune disease, the herpes simplex virus infection is the result of viral infection, and the oral candidiasis is the result of the fungal infection which is caused by the candida albicans. So first we go to discuss the Aphthous ulcers. Actually, the Aphthous ulcers, which are also known as the canker sores, they are small, painful, inflammatory lesions that occur in the mouth, right, in various portions of the mouth, the inside of the cheek, the tongue, the gums, the soft palate. These are the parts that we study inside the mouth. Now the Aphthous ulcers may is divided into four types. They are, number one, the minor Aphthous ulcers. By minor Aphthous ulcers, we mean that they are only a few millimeter across. They appear round or oval in shape, and these minor Aphthous ulcers, they occur and disappear within a week. Right? They are mildly painful, and when they heal, they don't leave behind the scarring. Now we call them as recurrent Aphthous ulcers. If they occur each month, and the common age for the recurrent Aphthous ulcers is from childhood to age 40, and its exact etiology and causes unknown. The normal minor peptic ulcers, they may occur 3 to 4 times in an year. But if they occur repeatedly, recurrently, each month, then we say these are the recurrent Aphthous ulcers. Now, the major Aphthous ulcers, as compared to the minor Aphthous ulcers, they are large. By that we mean that if an ulcer is more than 1 centimeter in cross, it would be a major Aphthous ulcers. Now, similarly, as the minor Aphthous ulcers heal in a week. The major Aphthous ulcers, they take a month to heal. Comparatively, they are more painful and their recurrence is more frequent. And since these are large, so when they heal, they may leave behind a scar. But as you know that acute inflammation, mostly when it is resolved, it doesn't leave a scar. But chronic inflammation on the other hand, it will leave behind a scar. The fourth form of the Aphthous ulcers are the herpetiform ulcers. Its name herpetiform doesn't mean that it has got any association with the herpes virus. The herpetiform ulcers, these appear as tiny discrete ulcers. By that we mean that there are many small ulcers located in the oral cavity, but these ulcers grow and they coalesce, unite to form large ulcerated patches. And about the herpetiform ulcers, remember that they typically affect the women. Now, as we said that Aphthous ulcers are nothing but painful inflammatory lesions in the mouth, and they typically arise singly or a few at a time. Right? The common sites of the Aphthous ulcers are the lips, the cheeks, and under the tongue. In the picture, you can see an Aphthous ulcer on the inside of the cheek and one below the tongue and the other in the vestibule, which is the on the gums. Now, what happens that initially in the Aphthous ulcers, a small raised bump, which is caused by the inflammatory reaction, it is formed. Now, what happens that when this small raised or this inflammatory swelling, when it heals and the membrane that covers the Aphthous ulcer or this small inflammatory bump, when it is removed inside, the ulcer appears, the Aphthous ulcer appears. And since these are the result of inflammatory conditions, the Aphthous ulcers, they are covered by a fibrous membrane cap. On gross appearance, they appear as yellowish white or grey. Its margins are poorly defined. By that we see that not well defined margins are there. And these ulcers, they are surrounded by a zone known as the red hollow. And what is this red hollow and what is this erythematous zone? It is due to inflammation in the nearby blood vessels. Now, the exact etiology of the Aphthous ulcers, it is not known. But as much we know that this is a cell-mediated autoimmune reaction. Better you remember that there are 4 types of hypersensitivity reactions: type 1, type 2, type 3 and type 4. And out of them, type 4 is the cell-mediated reactions. And mostly we talk about type 4 hypersensitivity reaction in association with tuberculosis. Now, in an immune reaction, either antibodies will be involved, which are secreted by the plasma cells derived from the B lymphocytes, or in an autoimmune reaction, cell may be involved, which are mainly the T cells, T lymphocytes. So, the Aphthous ulcer is a cell-mediated autoimmune reaction, and it is characterized by the accumulation of T helper 1 cells. Better you know, T cells, we divide them into T helper cells, T effector cells, T suppressor cells, and Th1 cells and Th2 cells. So, in Aphthous ulcers, there is accumulation of helper T cells of Th1 type, along with macrophages, and the inflammatory cytokines or chemokines, particularly the interferon gamma and the tumor necrotic factor. Now, as I said, that the exact etiology of the Aphthous ulcers is not known, but we know some external triggers that promote Aphthous ulcers and maybe the cause of Aphthous ulcers. For example, physical injury inside the mouth, like a bed tap, when we eat, sometimes we may cut our tongue unintentionally, we may cut the inside of the uh, cheek unintentionally. And the second trigger is the badly fitting dentures. If they are not fit to the mouth of the person, they will cause injury and damage to the oral mucosa. Some toothbrushes that we use, they may be so hard that they cause injury and damage to the oral mucosa. Stress and anxiety. This is very famous, that stress and anxiety, they cause Aphthous ulcers. जिस तरह हम कहते हैं कि परेशानी की वजह से मुंह में छाले पड़ गए, तो यही छाले जो है ना, these are Aphthous ulcers, and they are commonly seen in people who are under stress and who are anxious. Now, there are some systemic immune system disorders which are associated with Aphthous ulcers, and though these are systemic diseases, but Aphthous ulcers may be a part of it. For example, the celiac disease in the stomach, which is seen in patients with gluten, the intolerance, and the human immunodeficiency virus that results in AIDS. Some nutritional deficiencies, for example, vitamin A, D deficiency, B complex vitamin deficiencies, protein deficiencies, they may also cause the Aphthous ulcers. And here one interesting thing is that people who are habitual smokers, when they quit the smoking, they develop Aphthous ulcers. Now, as we know that smoking is very bad and it is the cause of many underlying diseases, but here what happens, that the person is all right when he continually smokes, but when the person quit the smoking, what happens, that Aphthous ulcers arise in her oral cavity. Now, here we don't know, but we can say that either smoking is having an anti-Aphthous ulcer effect, or more commonly, a patient who is a habitual smoker and who quits smoking, automatically he develops anxiety and depression. And this anxiety and depression that is caused by the quitting of the smoking may be the cause of Aphthous ulcers. Aphthous ulcers may occur more commonly in a family. Family members, they are affected more commonly, and so we can say that there may be some genetic susceptibility of the people with particular genes who develop recurrently the Aphthous ulcers. Now, four things that you must remember about the Aphthous ulcers. They are not contagious. A patient with Aphthous ulcers cannot infect other healthy people. There is no spread of Aphthous ulcers from one person to the another. They are located only to the persons who develop it. And Aphthous ulcers are not included in the sexually transmitted diseases. By that we mean that many conditions that we say sexually transmitted diseases like gonorrhea, AIDS, hepatitis, and other conditions, but Aphthous ulcers, they are not sexually transmitted disease. It is not transmitted from the one sexual partner to the other. The third point is that they are idiopathic. We simply know that what happens here in Aphthous ulcers, we know that a type 4 hypersensitivity reaction occurs, which is characterized by the accumulation of helper T, Th1 cells, macrophages, and some chemokines like tumor necrotic factor and interferon gamma. But the exact etiology is not known. Do we know some triggers? And the fourth point is that peptic ulcers, a patient may have a family history. The other family members may be having Aphthous ulcers, and this occurrence of the Aphthous ulcers in a family can be linked to some genetic problem or some particular gene may be involved. Now, coming to the summary, the Aphthous ulcers are canker sores. These are superficial oral mucosal ulcers, most common in young age. You can see in the picture that the ulcers are covered by the exudative membrane. The Aphthous ulcers are caused by cell-mediated autoimmune reaction characterized by helper T cells, macrophages, and chemokines accumulation. There is inflammation, which results in the formation of a raised inflammatory swelling or bump, and when healing occurs, the surface membrane of the bump or inflammatory swelling, when it is removed, we can see the shallow ulcers which are covered by a thin exudate, and they are surrounded by a rim of erythematous zone, which represents the inflammatory changes in the nearby surrounding blood vessels. Normally, particularly the minor Aphthous ulcers, they resolve in 7 to 10 days, and sometimes these ulcers in a particular person may recur 3 to 4 times in a year. There is no test for peptic ulcer, and it is not needed. Only the history of the patient and the appearance and that what we look in the oral cavity of a person, we can say these are Aphthous ulcers. But here there is one important point. Many serious neoplastic and inflammatory diseases, they may start or appear initially as Aphthous ulcers. So if we examine and we see Aphthous ulcer in a patient, we must exclude the possibility of some other neoplastic and inflammatory diseases which may be quite serious, and they may appear and start with the formation of Aphthous ulcers in the oral cavity. Now, if simple Aphthous ulcers, there is no treatment, there is no drug, but what we can do, that we must tell the patient to avoid the triggers. If particularly in major Aphthous ulcers, if the patient suffers from severe pain, we can advise some topical analgesics locally acting like lignocaine to relieve the pain. And if the patient suffers from some serious symptoms and there are very painful and large Aphthous ulcers, we can cautiously use steroids to have their anti-inflammatory and analgesic effects. In this picture you can see Aphthous ulcers on the right side below the nose and on the skin, and here on the left side on the back shoulder of the person, and here in the lower picture we can see Aphthous ulcers on the face. Now, after the Aphthous ulcers, the second condition that we study in disorders in oral inflammatory lesions of the oral cavity is the viral infection by the herpes simplex virus. Now, what is this herpes simplex? Herpes simplex is a virus. It is an envelope, by which we mean that it is contained in an envelope. It is a double-stranded DNA virus. You know, our viruses are either DNA viruses or RNA viruses. As in these days we talk more about the coronavirus, which is an RNA virus. So the herpes simplex virus, or HSV, it has got two types, HSV1 and HSV2. And usually the HSV1, it causes viral infections above the waist, by what we mean that it infects the mouth and tongue. The human herpes simplex virus, HSV2, it usually causes viral infections below the waist, and by that we mean it causes infection of the genitalia. But this is not an end to the possibility of the viruses infecting the various human tissues. Even HSV2 can infect the tissues above the waist, and even HSV1 can infect the tissues below the waist. But mostly, I say what I say, mostly HSV1 causes infection of the mouth and tongue, though it can cause infections of the tissue below the waist. And again, mostly HSV2, it causes infection of the male and female genitalia that are below the waist, but it carries the potential to cause infections above the waist and infections of the mouth and tongue. And therefore, we can say that there is a cross between the two types of the herpes virus. Now, the symptoms and the seriousness and severity of the herpes infection range from annoying to very serious and painful illness. So there can be a range of symptomless disease to a debilitating, very painful, severe illness. And you know that unlike Aphthous ulcers, the herpes virus, it is contagious. It rapidly spreads from one person to the other, and particularly it is included in the sexually transmitted diseases. And the time when it is very most contagious and very easily spreads to the other person is that when the virus filled lesions are present. But here one important point is that even the patient with no clear visibility of the herpes lesions and who are asymptomatic, but they are carriers and they can spread the disease to the healthy persons. So the most contagious time is when virus filled lesions are present, but even in the absence of these lesions and even in an asymptomatic person, but the one who is infected and who is a carrier of the virus, herpes virus, he can spread the disease to the other healthy people. Here one thing important that I want to clear, that if a person is immunocompetent, by that we mean that if his immune system is quite intact and powerful, the immune cells, they will kill the virus and the virus will not cause the disease in that particular person. But people who are immunocompromised, by that we mean that if they suffer from some other serious systemic diseases, if they are nutritionally poor, and if by any reason their immune system is weakened, he is the easy target for the viruses. And the same is true about the herpes virus infection. Now you know that viruses are either DNA viruses or RNA viruses. They are not cells and they cannot exist independently. What they do, they will use the nucleus and the metabolic machinery of the cells, live cells, where they enter, join their DNA or RNA into the cell DNA or RNA and start making viral proteins. Now these viral proteins are then packaged into the proper form of viruses, and when the cell ruptures, a lot of viruses are released and they spread mostly through salivary and genital secretions. Some viruses spread by airborne droplets. For example, in the current situation we are talking more about the coronaviruses, which spreads through droplet infections. But here the herpes infection, mostly it spreads through the salivary and genital secretions, and therefore it is included in the sexually transmitted diseases because their sexual partners, they can transmit the disease to each other. Now once the virus has entered the human tissues, what it will do, that the virus will enter into the nearby nervous system and into the neuron. Now in this neuron it will travel and go to the nearby ganglia or nucleus of the nerve. And once in the ganglia or the nucleus of the cell, the virus makes home here and lives here for his lifetime. Now the sensory neurons that are destroyed by the viral infection, but on the other hand they provide a permanent source for the virus. And living uh, in this cell of the ganglion of the nervous system, the virus is satisfied, and whenever he wants, he make copies of himself, and these copies are transmitted and they infect the epithelial cells of the tissues. Now we say that herpes, herpes simplex virus HSV1 commonly infect the tissues above the waist. So here in the face is located the trigeminal ganglia. Trigeminal nerve, you know, is the cranial nerve, and its ganglia or nucleus known as the trigeminal ganglia, it is located on the face. So the HSV1 infection, the HSV1 virus, it lives in the trigeminal ganglia, and on the other hand the neurons or the ganglia of the below the waist of the genitals, male or female genitalia, they are located in the sacral ganglia, and the HSV2 which infects the nerves in that region, they ascend through the nerve axon into the cell body and will live in the sacral ganglia. But once again I say that this is not an end, and it cannot be true all the time, because there are crosses over, and even HSV1 can infect the genitalia, and even HSV2 can infect the body tissues above the waist. Now the common triggers are the stress, skin damage, and viral illnesses, and particularly the weakened immune system. Now there are many variations. The patient may have no symptoms. He is infected with the virus, but he doesn't show any symptoms. But if the symptoms occur, what are these? Initially, there is a mild burning or tingling sensation. And this is a very important stage known as the prodromal stage. Why it is important? Because we can easily treat patients in this condition, and in this condition the spread of the virus from the infected persons to the healthy ones is comparatively less. And these prodromal symptoms, which is the mild burning or tingling sensation, it is felt by the patient 1 or 2 days before the appearance of the blisters. Now once the blister appears, then these blisters, they are filled with viruses, and at this stage the spread of the infection is very accelerated. The virus typically affects the children with lesions on the gums, soft palate, tongue, lips, and the facial area, and they appear as small painful fluid filled blisters, and which ooze leaking water, and they sometimes ulcerate, and normally they will heal in a few weeks. And since they cause inflammation, the person may suffer from fever, and there may be lymphadenopathy. By that we mean that the lymph nodes in the nearby area, when they are infected, they become swollen, and inflammation occurs in these areas, and they become swollen and painful. Now how we diagnose HSV infection? It is clinically based on the appearance of the lesions. We can take the fluid and we can confirm the infection by the PCR, which multiplies the viral DNA, and there is a serological test in which an antibody is given to the patient, it is injected, and if the person contains the antigen or the virus, there will be a positive response. Now, treatment of the herpes viruses is that most herpes simplex virus infections, they heal themselves. When the person's immune system kills the viruses, the person uh, uh, the person heals. The virus filled blisters, they heal, and no treatment is needed, and this will happen within a couple of weeks, and the person will be all right. Now, some systemic and topical antiviral drugs like acyclovir, famciclovir, valacyclovir, they can be used to reduce the pain and speed up the healing. But the topical antiviral are we can use topical antivirals, but systemic antivirals are kept for the most serious and life-threatening infections, because as we said that herpes infection is not a disease that is simply located to the oral cavity or female or male genitalia. It can cause and it can infect many other tissues of the body, and it is a systemic viral infection, and particularly uh, when it involves the brain, they become very dangerous. Now, the antivirals, topical or systemic, they are very effective in recurring episodes, uh, and particularly when a person which is in the prodromal stage, by that we mean that if he suffers only from the burning or tingling sensation, if we treat a patient at that stage, we can not only the treatment is very successful, but we prevent the person from infecting other people. Now, this is the summary of the herpes simplex virus infection. And as I told you that the virus infects the mucous epithelial cells where it multiplies, and it will use the host DNA for its replication, and the symptoms varies from annoying symptoms or no symptoms to very serious and life-threatening disease. When the ruptured infected cells, they when they rupture, they yield a lot of viruses to infect others people, and mostly the root of infection are the salivary and genital secretions, and there may be recurring episodes of small blisters which are filled with fluid containing the viruses, and most commonly it affects the skin and the mucous membrane, and the virus can infect the eye, central nervous system, genitalia, and other organs, and particularly the central nervous system involvement is very dangerous, and even it can lead to a situation of septic shock. Most contagious time for the virus is that when the lot of viruses are present in the fluid filled blisters, and the patient, there are very variations. Some patient may have no symptoms and at all, but the other may suffer from life threatening infections, especially when the central nervous system is involved. How we diagnose? Journal look and history of the patient, and we can do PCR for the DNA of the virus and antibody response to the virus, in which we have a prepared antibody in a serological test, and when we give this antibody, when we inject it to the person, if he is having the virus, he will give us a positive reactions. And virus growing in culture media, I think these facilities are not available still here, and we are hoping the future. Now, the third and last condition, inflammatory condition that occur in the oral cavity, is the fungal infection by the candida. Beta G, you know that many bacteria and fungi, they live as commensals on our body. They live here, but they don't cause any damage to the person. In this situation, we say that this is the normal flora or the commensals. But once the person's immune system is weakened, once there is less competition for these bacteria and viruses, they increase and overgrow their number, and now they are ready to cause damage. And if these fungi, sometimes if they get away into the bloodstream and enters into the systemic circulation, going to the other organs, in this condition they cause severe illness. Candidiasis itself is a fungal infection, but here at this stage we will only focus to its oral environment. There are many species of candida, and the most common one that infects the man is the candida albicans. And here the candida albicans, the favorite atmosphere for this fungus is a site which is warm and moist. So the body areas, the areas of the body which are, as compared to other tissues of the body, which are warm, by that we mean where temperature is increased, close, dark, and those that are moist. So these are the very favorite and this is the very favorite environment for the fungus. And you know that our mouth cavity, automatically as compared to our hands and other parts of the body, this area is warm. It is moist because it contains salivary secretions. Similarly, if you take a baby and the baby rash, particularly in the groins of the baby, which are also warm and contain the secretory sebaceous secretions, that is the very favorite site for the fungus. And similarly, the female vagina, again it is warm and it has got secretions from the glands in the vagina, and it provides a warm and moist site, which is the favorite site for the growth of the fungus, and the candida albicans grow here. Now what happens when the candida becomes pathogenic? Normally it lives on skin and mucous membranes, and when it infects the skin or mucous membrane, it can give rise to three types of lesions. These three types are known as the hyperplastic type, in which the tissue becomes hyperplastic; erythematous type, which is characterized by large number of blood vessels and appearance of the lesion is red; and the third is the pseudomembranous type, with the formation of a false membrane. And here in the oral cavity, which type of infection occurs? Pseudomembranous type. And when this fungal infection will occur, particularly when the person's immune system is weakened, by what we mean is that if the person becomes immunocompromised, what happens that the fungus starts growing. And as we know that the two stages in the life, when the person is very young, right, we talk about the infants and children, and when the person is very old, in these two stages of the life, the immune system usually it is very weakened, and therefore these are the particular targets of the candida albicans. Now when the candida affects the skin or mucous membrane, then the destroyed cells, and you know that the superficial cells of the skin and mucous membrane contain the protein known as the keratin, which make these cells stronger and resistant to the damage from the outside. So usually when due to fungal infection these cells are destroyed, and the keratin protein which is contained in these cells that all accumulate, and the destroyed cells with containing keratin protein, and the exudate will form a pseudomembrane, and therefore we say that the oral infection by Candida albicans is characterized by the formation of pseudomembrane. Right? Now there are certain situations in which the persons become immunocompromised. For example, diabetic persons and persons suffering from the AIDS, human immunodeficiency virus infection, and there are many other systemic illnesses which affects the immune system of the person. Here, one thing important that we must notice, that some people, they take immunosuppressive drugs. For example, peoples of transplants, peoples are peoples of various malignancies suffering from various cancers, and even some people take the, particularly the asthmatic patients, those who suffer from bronchial asthma, they use inhaled steroids, and patients of the cancerous conditions, they are exposed to radiations, radiotherapy, and some people, the same patient of the cancer may be under the treatment with chemotherapy, and all these conditions, all these therapies, they weaken the immune system of the patient. The person becomes immunosuppressive and he becomes more prone to the growth of this commonly and normally occurring fungus in the mouth and other tissues of the body known as the Candida albicans, and it becomes pathogenic and infect the person. Now in the mouth, the infection by the Candida albicans is known as the thrush, and here a pseudomembrane is formed from the dead cells, keratin and exudates. And what we say that the three types of the candidal infection, which are the hyperplastic candidiasis, pseudomembranous candidiasis and erythematous candidiasis. In the mouth, the type pseudomembranous candidiasis occur, and sometimes the infection can spread to the esophagus, and the esophagus becomes infected and inflamed, known as the esophagitis, and it can cause pain and difficulty in swallowing. The diaper region of the children, again a moist and warm situation. Here again the fungus can cause infection known as the diaper rash, and in this area we see the satellite lesions which look as tiny red satellites, and these are not continuous with the rest of the rash. Now the summary of the Candida infection is that it is a fungus and there are many types of Candida, but only some types can infect the man, particularly the Candida albicans, and normally it is a commensal, it is an opportunistic pathogen. By that we mean that it lives here, but its conditions are favorable for its growth. It can cause an overgrowth and can cause infection. And one situation is that when the other bacteria, which are usually destroyed by the use of broad range antibiotics, when they are less and if they are destroyed by the use of antibiotics, then the Candida get less competitive organisms and it starts an overgrowth. And the other situation is the immunocompromised patients because of diabetes, AIDS, other serious and systemic illnesses like diabetes and cancers and chronic diseases of the heart and other body tissues. So by any way, if the person immune system is weakened, there is a chance for the Candida albicans to grow. Now the common sites are those where that are moist and warm, particularly the oral cavity, the armpits, and the areas of the female under the breasts, and the diaper region of a baby and the vagina of the female. Out of the three types, hyperplastic and erythematous type, in the oral cavity, the pseudomembranous type of candidal infection occurs and it is the most common. And it is characterized by superficial gray-white inflammatory membranes which are composed of fibrinopurulent exudate containing the fungus and the dead cells filled with keratin. Now, here is a picture of the oral candidiasis, and one thing important that I want to tell you at this point, that if you take a tongue depressor, you can scrape and clear the area. And when you scrape and clear the area, you will see a red erythematous zone behind. But if the area cannot be cleared by a tongue depressor, so here we must look for the presence of other serious illnesses. The common conditions that promote the oral candidiasis includes the poor oral hygiene, diabetic patients, and the disturbed oral microbial flora, particularly when we take broad spectrum antibiotic that kills the other bacteria and gives a chance for the fungus to grow. And some strains of the candida, they are very pathogenic. As I told you that there are many strains of the candida, but only some of them infect the man, and of them the candida albicans is the most common. And there may be some very pathogenic strains of the candida albicans that cause more serious infections, and the immunosuppressions by any way, if the immune system is weakened in situation like organ transplantations, neutropenia, chemotherapy, and HIV infections, it will lead to oral candidiasis, which is commonly known as the thrush, oral thrush. And they appear as superficial curd-like gray to white inflammatory membrane, which is called the pseudomembrane, which is composed of the fungi enmeshed in a fibrinosuppurative exudate, and they can be easily scraped off to reveal an underlying erythematous base. But if they cannot be scraped, then we must see for other serious illnesses. The summary of the oral inflammatory lesions is that Aphthous ulcers are painful superficial ulcers of unknown etiology. As I told you that it is a autoimmune reaction, and many systemic diseases like diabetes and AIDS, they may be associated with the presence of the Aphthous ulcers, and Aphthous ulcers are divided into minor, recurrent, major, and herpetiform ulcers. The herpes simplex virus is a viral infection, and it is usually seen in the form of cold sores and a few number of the blisters, and when these blisters ruptures, they can cause spread of the viral infections to other healthy tissues, and when they heal, usually without scarring, particularly in minor Aphthous ulcers and recurrent Aphthous ulcers, but the major Aphthous ulcers may be associated with scarring, and as they may leave behind the scars. And one thing very important that we must remember is that the herpes virus goes into the nerve ganglia where they reside and lives for life, and from time to time they get reactivated, particularly when the person becomes immunocompromised. The fungal infection of the oral cavity particularly occurs when, for example, in conditions of poor oral hygiene and using broad spectrum antibiotics, and so many other conditions that we discussed, and particularly severe disease may occur in persons who are immunocompromised, either due to existing some serious illness like diabetes and human immunodeficiency virus, and persons who undergo transplants, and persons who are having neutropenia, and many other systemic serious diseases which weakens the immune system of the persons and give a chance to the commensal Candida albicans, the fungus, to overgrow and cause the disease. Thank you very much.